Welcome to Discover Health, a White Mountain perspective. I'm your host, Dr. Tom Barella. On this program, we try to explore some medical issues and health issues and use our local experts to go through these problems. And today is no different. We actually are going to invite back Debra Bergstrom from Arizona Dermatology up here in Show Low. We had an earlier program with her where we talked a lot about skin care and how to take care of hydrating your skin care and how to protect it from sunburn. But today we want to go on to another problem that involves our skin, a chronic problem that either affects you or your family at some time. And to do this, we're going to welcome Debra back to the program again. And our topic today is a little bit different.
Well, thank you, Dr. Tom.
Okay, well, I appreciate that. And today's discussion is going to be about acne. At least we're going to start with acne. And because it is a problem that affects everybody, isn't it?
I call this lecture the good, the bad, and the ugly. And we should call it an all-inclusive problem, no matter what your ethnicity, your age, etc. Well, you know, beyond 50. Acne is the 8th most common skin problem, and about 9% of the world has it at any one time. Right now, it's involving about 50 million Americans. And if you're a teenager, you're somewhere between 12 and 25. About 90% of people in that age group at one time or another are affected by this.
Wow,
Yeah.
90%?
90%.
Now, as a pediatrician, my biggest problem with acne came in the spring of their senior year.
Of course.
Because they all wanted to look good for the prom.
Because now it's an emergency. Sadly, when we begin to treat this, it's 8 to 12 weeks until we can see what we want.
Well, I know that it's an emergency for every teenager that wants to go to the prom.
Yeah.
But I know it's not a simple illness in the skin.
If it were, I wouldn't see any acne patients, and neither would you.
Yes, and you actually get the stuff that I can't treat easily. So let's talk a little bit and that's a lot of prevalence, 90% of teenagers. Does it occur at any other time in life besides teenagers?
You know, we were talking about this before, you and I, and there's a couple of special variants. Women between the ages of 30 and 50 have a lot of this. People who are on the verge of metabolic problems like diabetes, pre-diabetic conditions, insulin resistance, even one we call polycystic ovarian syndrome, which can affect younger women. That causes some hormonal balance shifts, and those are special forms of acne. So yes, it's more than just a teenage disorder. There's lots of people in different age groups that have this.
What causes it?
If it were simple, like I said, neither of us would be here.
Well, that's probably true. You wouldn't be able to have a show like this if it were an easy problem to deal with.
If we boil it down to the simplest concepts, there are two main factors. One is male or male-like hormones. They're called androgens. Big one is testosterone. Even women have testosterone, but the big part of that is how you bind your hormones. And therefore, the second factor is heredity. The biggest studies in the world have tagged all different factors in acne, and the two big things are how you carry around your hormones, and that seems to be hereditary. So bad acne runs in families.
Okay.
If we boil it down to basics, the skin plugs up and the skin is sticky, and that's because of our male-like hormones. And we don't slough oil out of our follicles. They begin to plug up, which attracts some bacteria. There's a special one that lives in our skin that forms acne lesions called Cutibacterium acnes, if anyone cares.
Okay.
As things plug, you begin to get a bigger infection, sometimes called a papule, when you can see it and it looks like a zit or a pimple.
And I know we'll talk a little bit about, don't you have a slide? You'll have a slide we'll talk about.
We have that.
A little bit. But it's a hormone issue.
It is.
It's a male hormone issue.
It is.
But I know women have a lot of female hormone because as women get older, they're talking about giving women testosterone to increase their sex drive.
True. As women age, the two halves of the monthly cycle: the estrogen cycle, where you make an egg; progesterone cycle, where maybe your body thinks you're going to fertilize the egg. Okay, become asymmetric. The estrogen cycle is weaker. The progesterone cycle is just as strong, if not stronger. Some things shift the balance toward male as well, like weight gain, insulin resistance, polycystic ovarian syndrome. We mentioned those, and those tend to come later in life for women. Okay. We have younger women. Unfortunately, obesity is
a big
pandemic in our society, and that shifts that male hormone balance. But you know, it causes people to get acne, and unfortunately, the later women's type and the hormonal types that have to do with insulin resistance tend to be the deeper, more scarring types. Unfortunate but true.
So insulin resistance, of course, is a big part of type 2 diabetes.
Yes.
And that metabolic disturbance also can lead to shifts in metabolism of male hormones and female hormones.
Stress hormones like cortisol are part of that. So a lot of people come in and say, I'm so stressed, my acne is really bad. And they're in fact factual about that. If their cortisol levels are way up, there's pathways between all these hormones.
But what you're saying is that the stress may precede the acne?
Mm-hmm.
So the cortisol, of course, is a stress hormone.
It needs to be chronic stress. It's not like today. You know, it has to be going on for a while and cause some hormone shifts with high cortisol levels and other things that act like androgens. So.
All right.
Not today.
Not today.
Yeah.
So it's not an acute thing. It's really a
chronic disease.
Chronic.
And the setup for teenagers is that at puberty the hormone levels soar. We all know that. We have them in our household.
We have them. Yeah. We had them. Fortunately, those years are over. So I have one other question for you that I know is going to cross everybody's mind. Tell me about diet related to acne.
So many studies have been done on diet. And the conclusion goes right back to weight gain, insulin resistance, obesity. If you're eating kind of an inflammatory diet, lots of meat-based fats, lots of carbohydrates, you're probably going to get into more trouble. Again, cortisol, the stress hormone, prediabetes. An anti-inflammatory diet seems to help. There's some research that shows that taking dairy products away from some acne sufferers is helpful, but it's only some. It's less than 30%. All the myths about chocolate and sugar, I mean, not exactly, but more or less it has to do with, are you eating an inflammatory diet? Do you tend to be overweight? Does your family have a lot of diabetes? Is the dietary method you're using causing a lot of body stress? So we would lean towards telling folks, well, if you're interested in acne and diet, try one of the anti-inflammatory diets like the Mediterranean diet, good oils, lean proteins, lots of whole grains and vegetables.
Any relation to antioxidants?
Of course. It's always great to have good antioxidants going for you. Can we say that if you eat a lot of antioxidants and take antioxidant vitamins, it will end your acne? We're back to the trouble with hormones and skin plugging and an infectious component. So I wish, but it doesn't hurt and it helps some.
Are there different types of acne?
So yes, simply, there's the kind we call comedonal, and the lay term would be blackheads and whiteheads. Those can progress into pustules or pimples or papules, and those look like surface acne that you can see. I guess the word is still zits on the street.
Well, but blackheads and whiteheads aren't really at the zit level.
No, and the next progression would be the zit level.
Okay.
What I get to see is the cystic level, but let's talk about the simpler acne forms.
Okay.
The comedonal acne, which is plugging, and eventually as you get to papules and pustules, the bacteria start making a big inflammatory mess. Most people with those acne forms, when it's not just covering them, can be treated with good interventions topically. So you said you were going to ask me about Proactive at some point.
Well, yeah, I want to go through the treatment of all the phases, but I mean, a lot of people use Proactive because it's over-the-counter type stuff.
So benzoyl peroxide.
Stridex over-the-counter.
Benzoyl peroxide, which is the active ingredient Proactive, has been around for years, and there's never been anything better to put on acne, okay? There's lots of theories about this, that, and the other, but benzoyl peroxide, sorry, stumbling there, is antibacterial. It does help with oil a little bit. It stays around for a while, depending on the form you use. And the bacteria can never get resistant to it, because when you break it down to its active component, it's hydrogen peroxide. Okay? No, hydrogen peroxide does not work. It needs to be in a form that goes down into the lipid layer of the skin if we can get it. Okay? So there's never been anything better. It's centuries old now, you know, in some form, hydrogen peroxide, and it works. It also helps prevent antibiotic resistance when we have to get that off the shelf. So I always recommend a benzoyl peroxide. I have some favorites because they're not drying. The biggest problem with benzoyl peroxide is it's very drying.
As is hydrogen peroxide.
That's right. And there's a form out there or two that are very moisturizing. So we can even use some forms, like Panoxyl is a great brand that's moisturizing, on older skin and get away with it.
Okay, and when you get to this, I mean, using benzoyl peroxide, Proactive and stuff, when you have comedones or open comedones like a blackhead or a whitehead, or do you use it to prevent from getting to that stage?
So remember we said there's kind of a progression. There's the whitehead, blackhead, the closing of the skin, plugging of the skin from the hormones and the sebum and the extra oil and the sticky skin. So the benzoyl peroxide helps that, but it helps the bacteria not to form the big festers. But we need some other things. A topical antibiotic might help. And there's some prescription topical antibiotics that help kind of prolong the benzoyl peroxide. There's some mixed with benzoyl peroxide, and those help. But what we actually want when we get the comedones and then the progression to the pimples and pustules is a retinoid. What does that mean?
Well, yeah. But most people can, I guess the question to make sure our audience understands is when they first started getting whiteheads and blackheads, is there, you know, what can they do to prevent themselves from going on to the yucky stuff that you're going to talk about in a couple minutes?
Benzoyl peroxide helps a lot. It may not deal with all the issues, like the skin stuck shut.
All right. Because that people can use at home, but the topical antibiotics and stuff like that require physician intervention. So, but most people don't end up coming to the physician or you as a dermatologist when they got whiteheads or blackheads? Mostly
not. By the time I see people, mom and dad are worried about scarring, and the kids are kind of very, very anxious and depressed about that. And how do I know? I get a lot of nonverbal kids in the office that won't raise their head or talk to me.
So it progresses from the open comedones, where they're just dirt and stuff like that, the blackheads and whiteheads, to the next step, which is?
So moderate acne we would call a lot of pustules, a lot of zits, and some inflammatory lesions, meaning deeper or more cystic lesions. And at that point,
a white-headed pimple with a red base, is that what you're talking about?
Yes, and some deeper that are red with no head, if you will. You can't pick them because they just get bigger.
So different pathology, or deep red one versus a whitehead.
Different pathology. And we also, just to branch off, boy, we try to teach people not to pick, but we're all human, and people can't seem to keep their hands off their skin. So
I mean, we teach people not to pick, but aren't there comedone and pimple extractors that are all over the...
But do you see the average teenager sterile scrubbing the skin and intervening with a sterile or clean tool, or with their dirty fingernails?
Well, that's a different issue. But a lot of teenagers will have or a lot of parents will use a needle and punch a whitehead.
When we're talking about blackheads and whiteheads, it's one thing. When we're talking about the deeper structures of acne, as you'll see in the slides, we start looking at a place where the follicle is broken, distorted, inflamed, just dysfunctional, out of proportion. We can't put it back. So when you start picking that, you're spreading bacteria, inflammatory cytokines, nice scientific word, and you're just creating a lot more trouble. You're also probably going to create some nasty scarring.
All right, that's a good point, because we want to, I mean, for the general public, so what you're saying is, so can you pick blackheads and whiteheads? Is that helpful?
Boy, I sure don't want to admit to saying that on TV.
Because I know that they have these comedone extractors with a little, where you press down on them and they, and the whitehead comes out, or the blackhead.
Safely done, maybe not too harmful, but there usually tends to be not one kind of acne.
Okay.
It's usually a big mixture, so not all of it should be treated that way.
Okay. Okay.
Best thing I can say.
You're the expert,
I spend hours begging kids not to pick their face, Tom.
Okay. All right. That's the purpose of that's the purpose of our discussion today, is because we want kids and parents to develop safe habits. So at the whitehead and blackhead stage, maybe keeping your face clean with Proactive prevents it from going on to the next step. And so when you get the whiteheads and the redheads, is that a good term? Redheads are the deeper ones where they're just red on the papules,
pustules, sort of variations of the same thing.
Now the white redhead with white heads on them are pustules, and
the deeper ones that don't really come to a head. Everybody's had at least one of these. They hurt. They feel like they come back all the time in the same place. Those are cysts.
When you get to that stage, a lot of parents, kids, will pick their pimples.
Yeah, and we do see some scarring acne. The moderate stage of acne responds to those topicals, but we need to add a retinoid, a form of vitamin A in a topical, and the purpose of that is not to chase bacteria and not to sanitize the skin, but to change the behavior of the oil glands. And topically it can be done, and these retinoids sink down to the oil gland, and I always tell kids it's like understanding algebra. You're not going to do it when you walk into class. In fact, you're going to hate it. Because the first thing it does is peel a little bit. It peels the skin. We have to start it slowly. But after 3 months, we can have that retinoid communicating with the oil gland and saying to the oil gland, stop being extra oily and spit that crap out. It reformulates the behavior of the skin, but it takes 3 months. Now, if we have very severe scarring acne, the topical may not work, the topical retinoid, because the cysts and the skin are so thickened and inflamed, we can't get down there. But for moderate acne, the redheads, the whiteheads, you called it, the pustules, the comedones, retinoids are great. There's even an over-the-counter one now called Differin. It's out there.
Oh, really?
There's an over-the-counter retinoid now.
Oh. Differin.
It's the mildest one they make. It's hard to hurt yourself with it, even if you overuse it. The biggest thing with retinoids is everybody can get to tolerating them, even older skin like mine. You just have to go slowly, and there's a titration for this. It's hard to hurt yourself with Differin. I've seen people do it, but that's why it's over the counter now.
All right.
And then again, the flip side is for some people's acne, it's not effective enough.
All right, so we have Proactive for really the milder stuff than when you begin to get pustules and papules, which are the redheads and the whiteheads, and then the next step after, if that doesn't work and you start getting these.
We also will add an oral antibiotic. Now, I try to keep it to 3 months. I don't want to see these go on forever, but we use it at a dose that will get rid of the junky bacterial festival going on, because it's big by the time they come to me.
I never thought of it as a festival.
It is. Everybody's involved. It's Woodstock. That dates me. But, we try to get rid of that. And in addition, the antibiotic class we pick most often, the tetracyclines, there's no tetracycline anymore, but minocycline and doxycycline, have amazing anti-inflammatory effects on the skin, seem to stop the cytokine cascade, if you want to talk about it from science. And if you want to talk about it as a layperson, your redness will be better in 2 weeks and your skin will stop being as thick. And what we generally do after 3 months is try to drop those medicines down to a non-antibiotic dose, non-antimicrobial, but anti-inflammatory only. And we can leave them there and they work. And they've been studied up to 5 years of just that low dose. We use that also in a related disease called rosacea. Doesn't destroy the body's normal flora, and we can kind of leave it there as an anti-inflammatory. So when you have moderate to almost severe acne, that works well.
So as the acne progresses, an oral antibiotic, because really are the
but not for
papules and
long.
the whiteheads, they're really infections.
Yeah, and they're connecting infections sometimes, and it's a festival, and kids are picking, and it's just, we got to stop this. So
I like the festival
Yeah.
idea. Okay, all right. So and so then having a few pimples or papules on the face, most people can live with. And then the next stage of it is...
Let's bring up the women's problem, because
okay.
there's a fit in there where we can try the normal things we try for moderate acne, but because in the middle-aged women, or somewhere before middle-aged, I would like to say middle-aged ovaries, not women, okay, because ovaries don't last as long as women, and women are insulted when you call them middle-aged and they're 35. Their ovaries are middle-aged.
I don't want to go down that way.
Anyway.
My girls are in those ages.
What we may need to do at that point is explain to women, your hormone balance is shifted toward androgens, and these women tend to come in with jawline, neck, and chin acne that's recurrent in the same place, deep and cystic and scarring, and it's very frustrating. Well-educated women will come in and say, why am I dealing with this now? I didn't have it as a teen. Recently I went off birth control, and we'll be like, there we go. Or I'm done with my kids, and why am I having this now?
Right, yeah.
And it'll be because their hormone cycles, as they edge toward menopause, have become more male-like, less estrogenic, more androgenic. Also, we get the whole thing of middle-aged weight gain, insulin resistance. So a treatment for that type of acne is to modify the hormones, and we've got a couple ways to do that. Birth control pills make you more estrogenic. They almost always work, but there are lots of women in those age groups that are like, I'm done with that. I'm not doing that. I'm almost 50. There's risk factors, right? And we'll talk about that.
That's true.
And so an old tried and true medicine called spironolactone, it's a diuretic. We use it for liver and heart disease and blood pressure, has a side profile we exploit. It goes and blocks the androgen receptors.
Right.
And it's miraculous for women's acne.
And there's a lot of women that have tried spironolactone. As an endocrinologist, I've even tried it on hirsutism, for the male attributes.
It may work for that well.
It does not work nearly as well, but there are women that do respond to it. So the answer is good point.
The hair thing is a toss-up, but the acne thing is nearly 100%. Mostly in my experience, and also in the reported literature, it's well tolerated. Of course, there's somebody going to have a side effect to everything, and spironolactone can cause some, and we monitor it.
So how do we prevent scarring?
There we go.
That's an important thing.
When we get to very severe acne, people need to understand that if their entire face, and probably their back if they're severe, and possibly their
chest too,
has acne, then it's very hereditary and very androgenic acne. And the standard of care, especially if you're dealing with male acne, because it's more severe, is to use an oral retinoid, which is called isotretinoin. It's been around for decades. Is that
Accutane type stuff?
It used to be called Accutane. That's no longer on the market, but there's 4 generics out there. And everybody has a fear that Accutane is the devil, but there are so many good studies. There were some bad ones, but there's so many good studies that are well performed that shows that in safe hands with safe patients, it's safe. It's very, very safe. Now, obviously, because there are some ifs, ands, and buts, the patients need to be screened carefully. Pregnancy is a huge no-no.
All right, so the last step is
isotretinoin.
Isotretinoin.
And we even sometimes find middle-aged folks, women and men, especially men in their 50s, that come in and say, I am so sick of this, and they're still scarred, and they still have back acne, and we can even safely use it there with safe practice.
Okay. Well,
and it destroys billions of oil glands, and it'll clean up scarring as well.
Cool. And we're getting down to the end. Surprisingly, we've gone very quickly on this.
Wow.
And so we need to prevent scarring. Once you get scarring from acne, I know this isn't really your expertise. What can you do?
Something we do. We have great scar treatments now. We've got something called microneedling that forces you to produce collagen in your scar. old procedure. We've done it for centuries called subcision, where we actually use a needle cannula under the scar to break up the tissue and form collagen. We can use dermal fillers after we've done the subcision to fill the holes if they literally have holes. Lasers, something called radio frequency, partial lasers. You know, full lasers are peels, big peels, and those are dramatically hard to recover from. But there's some, you know, smaller.
They leave your face very red too.
Yeah, smaller peels or partial light, and that's good. I'm a fan of microneedling. I see it work a lot of times.
Okay, so if you were going to give one piece of advice on people that are prone to get acne, the teenager, number one, you said, I think it's important before we talk that people realize that once they undergo treatment, they don't get immediate results.
We are re-educating the skin to behave differently.
All right.
It is a 3-month process, and during that process, we have to heal the existing acne.
All right, that's an important piece. It doesn't go away right away.
No,
and I'm going to thank you, Debra, because we're out of time. Again, it goes very quickly when you're on a good topic. And for those in our audience, hopefully you all are exposed to this at some time. And now at least you have a plan from the expert, Debra Bergstrom at Arizona Dermatology. And once again, thank you for watching.